All right, everyone, we're going to get started tonight with Miller Time. Welcome. I still have to figure out what the delay shows and what's reality. Maybe one of the people that'll be watching tonight can help me a little bit understand how better to do that. So we'll get right into it tonight. I'm State Representative Tim Miller. I serve District 17A here in Minnesota. I have the counties of Swift, Chippewa, Renville, and oops, there we go. Not bad. I timed it pretty good, didn't I? My volume went up on my phone. So anyway, I'm State Representative Tim Miller. I serve District 17A, which is about 110 miles west of St. Paul. And we're here tonight in the beautiful town of Princeburg. It's a lovely night. And tonight what I'd like to be able to do is we're going to have an open conversation here. And this is going to be driven by whether it be questions or comments that you have. So please, in the live chat, speak up. I want to hear from you. I have a couple of topics that we can talk about to start right off from the top, but I really want to talk I want to discuss what you want to talk about. Easier said than done, right? So as we get started, that's right, hippity hoppity. By the way, Yeetmeister, maybe we can have a conversation after this of when the good time is to kind of roll and get started with the live. So you don't have to look at me staring at the screen for 30 seconds. So, but to touch on one subject that I do want to cover regardless, so I'll get into that. Some of you may know about an alternative hospital site in Appleton. It's the TCMC, it's the Tri-Center COVID Medical Center. And I'm very proud to do what I could with that to basically break through the hurdles and address any issues from the state. But I will tell you that the CEOs out there and the other leaders from the five hospitals consisted of the hospitals from Lackaparle, Swift, and Chippewa counties. And they addressed the problem here in Minnesota and they got right on it. They're ready to go, folks. Took them about a week to get things ready to go, and the work has just been unbelievable out there. Now, an update on it, there was an article on in the West Central Tribune, I believe, this weekend. Here's the tricky thing is the article was accurate, but it was accurate for about 2 hours, in which they said they're running into some hurdles. We got through those pretty easily. It was more confusion than I would say hurdles. Yeetmeister, I'm actually going to talk about that stop voting for money because I want to have a discussion on the money. And I really want your input on this. Not just from you, Yeetmeister, but I want other people to add their comments as well on that. I have some opinions. But to wrap up with Appleton Prison, oops, you didn't hear me say that. The Tri-County Medical Center, which is at the Appleton Correctional Facilities, yes, it is out there at that place. They've really done a great job of converting it to look like a hospital. They even painted rooms. They took out things that might look like correctional facility, and I believe they've done wall hangings in the rooms, and they've made it as comfortable as possible for people under very trying times. What we've been told most recently is if it is needed, the Corps of Engineers have identified it. They toured it on Saturday. They think everything's ready to go, and if things get really bad, they're going to use it. Now, who's going to be in operational control of that? That's not real clear right now. As far as we know, we're going along with what we know best right now, and that's that those hospitals are going to be in control. But there is some talk that the Corps of Engineers might come in. We don't know what this is going to look like, folks. We need to be prepared. Plan for the worst, hope for the best, and I think we're probably going to land sometime in between there. So maybe one of the things that people can bring up tonight is what they're hearing from other parts of the nation. I've been kind of having my head down, dealing with the issues here in my district in the state of Minnesota. I don't know what's happening in New York. I had heard a couple days ago that Texas, folks, the one thing that we need to take seriously is when I looked at the map of the U.S., one of the arguments we've been having is that the virus is going to die off when it gets warmer. Well, it's in the 70s and 80s in the south right now, and that's some of the hottest spots that we're experiencing. So, again, let's hope that gets better, but that's certainly a concern. So I'm going to get right into some of the things. Thank you, Lily, for joining us. I will get to yours after let me see what she says. Yep, I will address that I will address that shortly, Lily, but let me get to Eatmeister's question about stop voting for money. So let me tell you what we've done in Minnesota, and then in the broad terms, the federal government. I only know what you're reading on the federal government, the $2 trillion stimulus plan, and I think they plan on spending other money. But here in Minnesota, what we've done so far is out of the gate, we had some funding packages, and they're emergency funding, and they're only going to be used if needed. And I do truly believe that with this initial funding, we had a total of just a little shy of $250 million. I don't want to make light, that's a lot of money. But that was money that was put into different emergency fund pots to be used by hospitals, clinics, EMS, the different people that are on the front lines with this. If people get very sick, it's meant to basically pay for the operational costs of that. Not purchasing new things. Supplies, yes, but like respirators and stuff like that, the money isn't going to be used for that at this time. We believe if that's going to be coming, it's coming from the federal government. That money is going to be spent on the extra hospital staff, nurses, overtime, masks, gowns, all the things that you would expect we'd have to use. And so that money, really, that $250 million is going to be used only if needed. Now, in Minnesota, what happened last week, you heard a lot about what was happening at the federal government, but what was happening last Thursday in the Capitol is a bill was brought forward that was mutually agreed upon in advance, not very far in advance, and without some public input. I have some issues with that we can maybe get into if you want to know. But anyway, that was basically $330 million. That money went to things like support for daycare, support for unemployment, small business loans. There was some policy changes that we would have done in a regular session. This is the second year of session, so we do some policy adjustments in a lot of different areas. A lot of that language was in there. I saw the policy change languages from my committees. They were very non-controversial things, just things that we got to fix in the state of Minnesota. Where the controversy came in is the different ways in which we presented money, also to food shelves, for example. And I want to be clear with something on that. That money that was there is really intended, the intent is to drive it down to the local people that need it. Where my concerns come in is I don't know that that's totally going to happen with the $330 million. The other concern that I have is where the money's going to come from. Now, we talked about a surplus here in Minnesota of $1.5 billion. I want to be clear, this is a good time to understand what a surplus means. When we get our February forecast, it says through the rest of this biennium, if spending continues where it's at, we'll have a difference in spending and income of $1.5 billion. But that has worked into it assumptions on the economy, that has assumptions on tax revenue, and of course it has assumptions on how we spent money. So as we're spending this money, that goes against that. The economy is really suffering. I think I heard unemployment in Minnesota is now already at 20%, which is just unfathomable to me, if that's an accurate number. And that means tax revenues are going to be going down. Businesses are shutting down. Tax revenues are going to go down. So you can see how our revenue is going down and our expenses are going up. We don't believe that money is necessarily going to be there in the forecast. So we need to be very careful about how we spend money. And it isn't real clear where that $330 million. We have money in reserves. We have money in the general account right now. It isn't like we're making up money that we don't have, but we need to be very judicious with that. So any spending going forward from the state is going to have to be very careful. At the federal government, and I'm just going to spend another minute because I'm seeing good questions come through here, but the federal government, we did that $2 trillion stimulus package. We can have a discussion about that as much as you want here shortly. My concerns on that is that's printed money. We literally printed money, maybe some borrowing in there mixed in, but basically we just came up with that money and we're sending it out. My biggest concern is with that is in the aftermath of this, when we really see what the economy has done, where we see really where the hot spots were, where the problems were, all those different things, that $2 trillion is already out the door. Where are we going to find that next money, or should we have to spend money on something? So that's a big concern of mine. That's yet to come. Lily, I want to get to your question. You said, can we please fight to not let criminals out of jail and prison? Letting prisoners out not only is absolutely dangerous, but it doesn't even make sense. Lily, I agree with you. I don't think it's good. I know that they're concerned about the spread within the prison and county jail, but understand at the prison level what they're going to do is if someone has under, I think it's under 3 months, so it's under 90 days time, and they're going to be put in there, they're putting them into the county jails. Well, the county jails, that means they're going to be affected. Now you're taking people that might be infected in the county jails, and then you're moving them out into society. I don't understand the logic in it. I think that, believe it or not, I know that it could spread through the jails and the prisons, most certainly, but they're equipped to isolate there. Kind of like my Tri-County COVID Medical Center out in Appleton. Those facilities, by design, are meant to isolate people out, and I think keeping them put is the wisest thing. It's not my decision right now. An executive order did that. So anyway, keeping on with questions. Meister said keep the courts open. Absolutely. And we're getting from the Supreme Court of Minnesota some direction because they wanted to waive speedy trial, but that's causing some problems. So I think we're going to be addressing. Stay tuned to that. I think that's going to be addressed in the next week or so. David Hansen asks, what discussions have been conducted concerning school districts and the money they are spending on all of the services they are providing free of charge? Yes, health and medical is first. That's understood. I think that's the way you meant that. So, David, first of all, thanks for coming in. I believe that you're in leadership in one of my school districts, so I really appreciate you coming in. And I'd like your feedback on this, if you could, through the chat. The discussion right now, beyond what the executive order has been sort of we're going to have to see how that plays out. We don't know is the answer. I believe, and David, correct me if I'm wrong, I believe we're sending money to the school districts with the assumption of the daycares that you're doing for medical professionals. I do think that is one area that we're addressing already, so please clarify that for me. But I believe that's the case. But as far as the cost to the schools, we're going to have to shake that out after the fact. We're going to have a lot of areas like our public school system and many other areas where we're going to figure out how to fund unexpected costs. It's going to be a top priority. I just don't know how we're going to be able to do that yet, because remember, again, we have to have a balanced budget in Minnesota, and we don't print money. So where's this money going to come from? Is it going to come from the federal government, or are we going to have to make cuts somewhere else? There's going to be a lot of difficult work ahead. Lily asks now, what happens with all that money if cases of COVID start dropping and we're nowhere near the numbers that were anticipated? Great question, Lily. And when it comes to the medical money, the stuff we passed in the first couple of weeks at $250 million, it's a great question. That money is set up that if it's not used, it automatically goes back into the general fund budget. Now, here's another good thing. When it comes to the medical stuff, the health insurance plans, they're going to be paying into this. There's going to be federal government that's going to be paying into this for Medicare and Medicaid. There are, I'm blanking on where other money's coming, but the normal money that comes into the healthcare system as it is now is the money that gets spent first. So the taxpayer money that's being used on these medical costs comes after that. And we really believe that the federal government is going to backfill. So that $250 million was a good reserve fund to put in place should we need it. As of right now, I'm confident we probably won't even need that, and that'll go straight back in to the general fund. Can't say the same about that $330 million that was passed last week. So anyway, Yeetmeister, I know you're at least I hope you're joking about what Appleton, the TCMC, is going to be. That is not a FEMA death camp. That is organized by local people, and it's an incredible facility. Lily says, can we please fight to not let criminal... Oh, we already did that one. Sorry. Need to bring it down here a little bit. Okay, Keith Woods. Do you think the governor will extend the stay-at-home order? Any idea when the peak is projected for Minnesota? Two fantastic questions, okay? So let me address the first one. Do you think the governor will extend the stay-at-home order? I can't honestly answer that. His emergency powers are going to be ending here. Simply put, after 35 days, he's going to have to come to the legislature to extend his emergency powers. Now, here's the tricky twist, is if you remember, somewhere late last week, he extended the restaurants and bars to be closed all the way through April 30th, till May 1st is when they can open. He was able to do that a little bit, but he's able to do that because he has emergency powers now, but also through the Department of Health. So that's a little bit of a twist on that. I didn't think he can do that, but he can legally do that. But when it comes to the stay-at-home order, he's going to have to come back to the legislature. And I'm going to have very serious reservations on that. This flows well into your next question. Any idea when the peak is projected for Minnesota? So here's kind of my best understood way to say that. We do know that the surge is probably coming here to Minnesota beginning about the middle to end of this week. So in the next 2, 3, 4 days. Folks, that's when we're really going to get an idea of what this is looking like in Minnesota, at least as is projected, as they say in the models, okay? When we see that happening, there's a rule of right now in the model, a 6-day doubling. So there is a doubling of the number of cases, and 5% of those are going to be hospitalized, and 1% to 2% of those are going to be in critical situation needing a ventilator. But now remember, as we have those numbers increase, we have people on the front end that are coming off of the COVID. It lasts about 2 weeks. So there's kind of this overflow. And so when they're talking about flattening the curve, they want to get that peak as low as possible. But kind of what also is presumed is that if the peak is lower, it's going to last a little bit longer. So the way that I'm seeing it is, the numbers, don't hold me to this, but the numbers in Minnesota is we're going to see this really coming on strong by about the end of this week. It's going to peak, if I understand properly, about 2 to 2.5 weeks after that, and then we'll tail off. That's kind of the curve that we're going to see there. But I think it's pretty fair that we're going to see what it looks like here in Minnesota, where the hot spots are, perhaps where it's not so serious, and all of that we're going to be seeing here coming real soon, folks. That will have an effect on the stay-at-home order. Now, when the governor gave the stay-at-home order, he did say that this is 2 weeks, only 2 weeks, and this is with the intent of flattening that curve, and we believe that will help, and to everyone, please honor that. So to the degree of what really happens or doesn't happen, it's hard to say. To the degree that the 2 weeks it stays home helps or not, it's hard to say. A continuation of those 2 weeks, hard to say. So I wish I could give you a clear answer on that, Keith, but that's our best known information. By next Monday, and I plan to be on the show again next Monday, we can probably start looking at what we really, truly know. One of the biggest concerns I have is that a lot of our work is based on models and guesswork. And that's the best information we have. I'm not saying models are invalid, but we don't know. The thing that I struggle with is the reason why we don't know is because we can't test as much as we want because of the testing kits, but also the labs that process them. And that's something that we're going to have to look at seriously, folks, after this as to why we weren't prepared for that. We don't have a lot of information across the whole U.S. by and large because we're not testing. Right now, we're still only testing medical professionals and those in the at-risk categories, which are people over the age of 70 and people that have immune deficiencies like cancer patients. So we're really going to see what happens in the near future. So David asked, with the Appleton facility, would they, quote unquote, ship cases there from other parts of the state? So the simple answer that I can give right now, David, is the best information I have right now, and the answer is no. This is going to be for the local use, first for those 3 counties. There's kind of a protocol that they're moving forward with. They fill the hospitals first, then they're going to use a facility like that. Could we see cases from Big Stone or Stevens County? Absolutely. And I know that all those hospitals have been talking with each other. From Kaneohe County, absolutely. I know that Karis has more capabilities in Wilmer, so they might take a little bit longer to overflow. But from what I've been told from state officials, that is going to be a place for that. Now, what happens if things get really bad throughout the state? The best answer that I can give you for that is that the Corps of Engineers have identified that, and they're kind of assessing the whole state and the, if you will, the where our resources are located and where resources need to be. That's going to be in the mix. We have the ability out in Appleton right now. It's going to have 12 beds, but it's easily scalable. When I say easily, there's a lot of work, but it's already in place that we can scale that up to 88 beds. So if we're not having a lot of cases here, but it's flaring up somewhere else, St. Cloud, and they just need the beds, you might see that coming down. But it's a regional priority until we overflow, then we have to reassess. That's kind of the way that it's working. Meister, how can the legislature punish Walls for screwing? Okay. One of the things, and I know this person, so there's a little bit of sarcasm, but some seriousness in it also. We need to work together right now. Okay. You see behind my shoulder, I put on the whiteboard that just happened to be there. It's the best I could do is be safe, be smart, be kind. Don't be afraid. We do need to be kind. We also need to be patient with all people. Governor Walz, I haven't agreed with some of the decisions, but he is the governor of the state of Minnesota, and with that, he is afforded the authority to do certain things. I'm going to hold the line when I think that he's doing things too far. I've been pretty clear that I think the closing of the restaurants could have been done differently. I think that the stay at home could have certainly been done differently. I think it could have been, excuse me, nothing to drink in here either, folks. You get this the rest of the way. Wow, I didn't come prepared. I don't think it was appropriate, but at the very least, I think it could have been done differently. I think they put a charge in a lot of people when you say you're stay at home by penalty of law, and it created the wrong atmosphere. But if people listen to that, we're going to be better off, so please abide by that. But after everything's all done, we're going to have to assess and say, how can we do things better? I can tell you in politics, politics are not really there right now. We're getting along, but they're going to come back full force when this is all over. It's part of our system, folks. So moving on from that, David, in Word, the emergency daycare is funded. Not sure if it'll come through, ? I think most districts could float the cost, but not for long. Some may need to cut programs or teachers, and I hope not. David, this is one real concern of mine. The bill that was passed out of the legislature last week, the way it's worded, you guys know, if you listen to me and if you know me at all, I'm a straight shooter with this stuff. I don't think it was worded in such a way. Let me start that over again. I have very serious concerns with the way that it's worded, that we're going to be seeing funding for the daycares out here. I hope I'm wrong. I'm going to continue fighting for that. And if you're a daycare in my district and you are not getting that support that you need, you come to me right away and you tell me, and we're going to go deal with it. Okay. David, Appleton facility. Yes, I agree. Thank you. Area counties. Thanks. David Hanson, I do agree. Anything we can help these businesses survive this, we're going to need them when all this is done. So let me touch on this from a slightly different tack for a second. This has been sort of posed as we've been entering into this difficult time is, do we worry about the sickness or we worry about the economy? And I think that's a false proposition, okay? There is no linear, those are on two ends of the spectrum, and where do we mark in between those two? This is very dynamic, it's very complex, and yes, those two may play off each other, but even with a bad economy, we're gonna have health crisis issues, mental health related issues. There are other things. The businesses, if they are closing down after this and we have severe unemployment, we don't have basic services around here from our businesses, you go into the large scale, and I was talking to people about the airlines right now. What happens if the airlines just totally crash? Is there going to be a bailout for airlines? I know people that say yes, people that say no, but we do need air travel. So what do we do with all that? These are going to be some very rough and bumpy roads ahead. What we did in Minnesota was we have $30 million in last week's bill, again, $30 million in small business loans. And I know that the federal government is coming forward with money as well. I'm thankful for what we can do, and we can't necessarily do everything for everyone. But I can tell you my small businesses in my area alone is just going to add to debt that they're compounding every day here. And I don't know that the loan may be our only option, but I don't know that it's a real great option. Certainly concerns for that. And that really troubles me. As some of you know, I've been going to some of the local restaurants just to pick up dinner as takeout, just to kind of give them a little bit of support and maybe do a morale boost, and then advertise on Facebook. When I've talked to those business owners, things don't look real great. They don't operate on big margins. They don't have huge reserves. They're trying to keep their employees on where they can, but that doesn't last for real long. And then you have low-income wage earners and servers and bartenders and stuff that are out of work, and that's a real problem. So that, in my opinion, coming out of this, other than lessons learned and what we need to do differently, and probably some finger pointing at each other, but when we really look at it, I think our economy, I have some major concerns there. So Keith asked a couple weeks ago, I believe you said the state has about $3 billion in the unemployment fund. If that is depleted due to all claims, will federal funds help support that? So I didn't say the $3 billion, but I think that is about the number, or I may have posted that somewhere else with the help of my staff. I do think that's about what we had. When you're talking about depleting it as it's depleted, yes, the federal government, part of that bailout, part of the stimulus package, because that sounds better, right? The $2 trillion stimulus, there's unemployment coming to the state. I don't know how the money's going to be divided, but preliminary numbers were as the federal government was going to be sending $2.4 billion to the state of Minnesota as part of that package. I don't know where that goes. None of that's been shaken out yet. I don't know that anyone really knows exactly what that looks like yet, but that will certainly go towards unemployment, among other things. David Hansen said, is there anything we should or could do to help with the supply chain problems? And not just the toilet paper. Well, there's a real basic thing for the consumer that I know we can certainly do with the supply chain problems. And that's, if you need it, get it. Don't get 4 of them, right? No, it's sort of nerve-wracking. But I tell you, I was just in a grocery store today. I kind of stop about every couple days, whether I need to or not, in the sake of we need something in our house. But that's something that I want to assess. And I think right now in our stores, that gives us an indicator of what's happening out there with the consumer. Toilet paper aisle still empty. Sanitizing or the Lysol wipes still empty. But I will tell you that throughout the store, the other inventory in the store is increasing and replenishing. Canned goods. There's always been milk there. I've never seen milk run out. I've always seen at least maybe like a case of eggs, but now the egg section in that grocery store is now filling up. In the lunch meat, in the hot dogs, all those different places. we're seeing plenty of inventory there. So I think that's a good sign. But I think the way that you can help everyone with the supply chain is do that. I'm really proud. One of my good friends, Cal Barr, is a truck driver, and they've been busy driving trucks. That's part of the supply chain. We need to make sure that farmers get out and work because that's the start of the supply chain, of course. But those, I think, are some of the things that we're excelling at right now. The United States as an economy, one of our strengths is that we have that network, that supply chain, that integrated supply chain on all sorts of goods, really going good, and I think we're going to continue to do that. Let me see. Eatmeister says, how long until the legislature starts dismantling non-essential state agencies? It's a good conversation that we're going to have in the future. One of the challenges that we're going to have coming up in next year's sessions, should I be reelected, it's not going to be a fun time there next year. We don't know what it's going to look like, but we're presuming that we're going to have a budget deficit. And in Minnesota, we have to have a balanced budget. So you adjust that budget deficit by two ways. You cut spending and you increase revenues. We also have an emergency rainy day fund of about $2.4 billion right now. I don't think it's any more rainier than what we're looking at now, so we're definitely going to need to use that. But that's all going to be tough. That's all going to be real difficult conversations that we're going to have. But there is one silver lining when you have a budget deficit. It forces us to look at all the spending that the state does, and we just have to cut. Now, we'll have battles as to what priorities are in the state, but that is a good time where we lean things out and we really look close at what we are spending money on. So like I said, that's maybe small in comparison to the challenges we have ahead, but that is certainly a silver lining when we do that. And so in regard to non-essential agencies, I think we're going to be looking at some ways that we can cut the excess in agencies, because here in Minnesota, we have lots and lots and lots of excess. So David says, agreed with the farming, ! Huge deal out here. Let me address that for a couple minutes. And by the way, this is going good. We're at 7:30. I'm probably going to go for about another 5, maybe 10 minutes, and then we'll probably start or stop for the night. So if you have questions, this is a good time to get those out. But I want to address farming. We've been blessed, other than the rain that we had over the weekend, which was a little excessive. We've been blessed with kind of a good transition from winter into spring, and that gives me some optimism. I think the planting we might see some planting coming here in as little as maybe 2, 3, 4 weeks, and that's a good thing. As we approach that, please pray for our farmers because they're already in a tough circumstance. I think they're ready to go, and I think they're going to do a great job. Fully confident of that, and they're not going to need to plant crops, and they're doing a great job with their livestock right now. So that's one part of the supply chain that was mentioned before that I think is going to be, I'm a little bit optimistic on that. Now, commodity prices still aren't great. I honestly believe when we come out of this that's going to be one area. I've talked to some people in agriculture locally. I haven't talked to the economists in agriculture, but I've talked to local people, farmers, elevators, and they think that we probably should see some good prices coming out of this, so that'll be an upside to all this. Also, thank you for working with other area representatives and senators. It helps when it is coming from a common direction. Couldn't agree more, David. We all need to work on this together, and I will tell you that we, for the most part, have. There's some differences of opinion. Our system is set up to express those differences of opinion, but we make the decisions and we move on. Eatmeister, please remove Walsa's emergency powers and replace it with a request from Minnesotans to be careful and use their best judgment. Well, here's the deal, Eatmeister. In current law, he has emergency powers for a total of 35 days, and we're well into that now. But he's going to have to come back to the legislature. And unless I see indicators that are absolutely critical, I'm not going to be very quick, because these emergency powers are supposed to be very, very rare. Why? Because he has incredible express powers that supersede not only the legislature and the courts, but also your rights under the Constitution of Minnesota and the Constitution of the United States. I don't take that lightly at all. So I'm not so quick to say, well, he needs some more time. This is a very serious decision that's going to have to be made, and it's going to have to be proven to me for me to support that. And right now, I'm not convinced. Keith, I just want to say I really appreciate these chats. Good info. Keith, I appreciate that. When it's kind of one directional with people talking, meaning we're not bantering back and forth, I don't have a person sitting next to me. I have had that once. I feel like it's me just going on. And I think when I get a little bit into it, I rush it a little bit, and then I critique myself and hopefully improve the next time. That's for me. You shouldn't have to worry about that. But I want to make these interesting. I want to make them informative, but most important, I want to make sure that you're getting the information that you need. So that means a lot to me that you said that. I hope you are understanding by now. I'm not trying to be controversial on these things. I'm trying to be informative. There may be topics in the future that we talk about, but right now, just being argumentative isn't solving any of the problems that we're facing. So I believe in my defined position of representative, state representative, and I believe that goes two ways. I represent you when I go to St. Paul, your interests and wishes. Can't make everyone happy, because at any given time, about 52% of the people agree and about 48% don't agree. But I try to be respectful of even that 48%, or when I'm making a decision that I think is best, and it may not be popular. I encourage people to challenge me and ask me questions on that. But I think it's really important. And then I also believe that the information that comes from St. Paul, or things that are happening there, or information that you need through the agencies, I can bring back to you. So, well, Keith, thank you again. I'm glad you know and defend our Constitution. Without that, we have nothing to stand on. I'm going to close with that. There's some people that say we're in emergency and we should not worry about our process. The Constitution, for some, almost seems to get in the way of expediting things. It's my belief that during the tough times is when we really need to rely on our system. It's gangly, it can cause difficulties, it can be challenging, but our republic is still the best system in the entire world, and I firmly believe that, and it's based on our Constitution. So in times of crisis, we need to rely on the Constitution even more, and we need to allow the process to happen. What's incredible about the United States for me is when you look at wars, or you look through the Depression, or you look through other challenges that we faced, things don't look so good early on all the time. But then you see us kick into gear, and you see the system that we have where the locals have input. The local people are what drive things that make us an incredible, powerful force. There is an expediency to centralized powers, but those centralized powers over time can quickly, not even over time, they can quickly be abused. And also, when you start having a small group of people making decisions, then the best decisions aren't always come across. So in these difficult times, I want to close with this. Damon, thank you for being so accessible and willing to keep us informed. Thanks, Damon. You're a good friend of mine. Thank you. But I want to close with what I have over my shoulder here. As we go through these very difficult times, whether it's the sickness, economy, whatever issues you're facing, the stress of this, I know that there's people out there that struggle with their mental health, and I pray for you. But in all this, be safe, be smart, be kind, but don't be afraid. We'll get through this together. Good night, everyone, and God bless.